If you're curious about whether or not endometriosis pain is kind of like having contractions, I will say it for the record here. They're quite comparable. Like my whole pelvic area feels like basically a bomb is going off. Burning, cramping, I feel nauseous. I actually don't feel like I have much of an appetite. Knife-like, not great. It's not a great pain. So today I thought I'd talk a bit about what endometriosis pain actually feels like as someone who has endometriosis, who's had symptoms of endometriosis since I was basically 12, and even after having a baby still continues to struggle with pain with endometriosis. And so I thought I'd just talk about what it actually feels like for me. And I think just a point to make is that endometriosis pain feels super different for everybody. So this is just my experience of how I experience endometriosis pain. Basically, for me, when I have endometriosis pain, first of all, I thought I'd kind of clarify like when I have pain. And pretty much for me, since I was 12, which is when I got my first period, I've always had the worst pain when I actually have my period. That's when like the worst part of my endometriosis pain is really there, is when I'm actually having my period. And typically it's like the first 48 hours, I would say, of my period tend to be like the worst days in my whole cycle. Whereas some women have pain, like every day or multiple days in their month. Some women have a lot of pain before their period and like after their period or during their mid-cycle. This is all like common with endometriosis. And I do get pain in other times of the month, sometimes during ovulation time. But typically it's like the worst pain for me is like when the first 2 days of my period are pretty bad. And how I would describe that pain is not great. It's not a great pain. It feels like on a scale of 0 to 10, 10 being like the worst pain of your life. I mean, I would say when I first had my period and I would have endometriosis pain, it was absolutely like 12 out of 10. Like it was the worst pain I could have ever experienced. And I would say my pain now is still fairly severe. It can be quite severe, but I think it's hard for me to give it like 10 out of 10 because I'm so used to having this pain that you kind of get used to it. Not that it's any easier, but it's like a more familiar pain for me. And so I think that a little bit dials it down to like an 8 or 9 out of 10 for me, that there are absolutely still many days and many moments when I'm having pain where the pain goes from like 8 to like a 9 out of 10 to like a 10 out of 10. So it can really like fluctuate even when I have those first days of my period that are really bad, can definitely get like really bad in certain moments where I'm like, this is terrible. And for me, the pain feels like it's like cramping really does feel like the best word, because cramping to me kind of describes this like pulsating sort of pain that kind of goes kind of between like the 8 and 10 range again, where it's like always bad and then it gets like really intense. And cramping for me feels like it comes everywhere. Like it like almost surrounds my whole lower abdomen, like my whole pelvic area feels like basically a bomb is going off. There's a lot of like pressure. There's a lot of like bloating that happens. So there's just like a lot of like discomfort at that time as well. A lot of women get symptoms of like having bladder issues and like bowel issues, especially at that time as well, which is definitely true for me. A lot of women have, issues with their bladder and their bowels, especially like during that time. That's also true for me. But kind of like back to the pain, words like burning, cramping, knife-like, those are all words that I definitely feel fit for me when I have my period. And I think like I actually texted 2 of my friends who live here who have been diagnosed with endometriosis. I asked them, I'm like, give me a couple words to describe your endo pain. And a few words that came to mind are, with my Frozen 2 phone, stabbing, constant, flashes, cyclical, relentless, debilitating. Debilitating came up for both of them. And I think, those are all words that I can definitely relate to as well. I think other women sort of describe their pain as like maybe more gnawing or like a dull pain or an aching, or other kind of like common words to describe endo pain. And I think I would say that when, like I said, when I had my period when I was 12 years old, that was when I got my first period. I mean, the pain then was, it would last like the full 7 days of my period. Like I would have this intense, like awful pain. And I mean, it was already a time like when you're 12, when you're getting your first period, there's lots of different emotions happening. It's like kind of an exciting time. It's like a scary time. It's confusing. You know, other girls are talking about getting their period, and if they don't have pain, it's like, you know, it's like a different experience. Whereas for me, it's like, this is not cool. This is terrible. You know, I have nightmares between my cycles because I was just so young, and I would be scared of experiencing this kind of pain because it was really awful. So I think like how my pain has shifted since then is I have had surgery a couple of times. And I would say that after having surgery, like as we know, there's no cure for endometriosis. Surgery is something that, you know, isn't right necessarily for everybody, but for me, I've had surgery twice. Haven't noticed a huge change in how much pain I experienced with my periods after having surgery. The one thing that has shifted for me since having surgery is that I feel like my pain doesn't last as long as I used to have pain for like prior to surgery. So like I said, I used to have pain for like 7 days, and then following surgery, it's typically like the first 2 days of my period are pretty bad. And then usually by the end of the second day, I'm able to take, you know, a Tylenol and, you know, maybe one Advil, and like that will kind of get me through the remainder of my days of my period. But, you know, again, when I was younger and had my period, it was just like, it was debilitating for like much longer. In terms of other days of the month, for me, the other days that I have pain, I do sometimes get severe pain kind of like during the mid-cycle of my period. So typically during ovulation. And I don't get it every time, but I would describe that pain as kind of like, you know, when you go to the dentist and they have that little like suction tool, it for me feels like a little suction tool, like just sucking on like one of my ovaries, but like dial up the intensity times 10. Or just like straight up like a knife, just stabbing me on one side. So also not a pleasant experience at all. But I feel like my ovulation pain tends to last, you know, maybe a couple hours at most. And so it doesn't knock me out for like the whole day or anything like that. But that pain can be like pretty nasty as well. And then as I've mentioned before, in terms of like other symptoms with my endometriosis that I have is, and this is something that's been newer for me in the past, like probably starting in like my mid to late 20s, started having a lot of like nausea with my period as well. So it's like the first day of my period is like, I feel nauseous. I actually don't feel like I have much of an appetite. I do notice emotionally, like I am a bit more sensitive those days as well. And I just feel like the energy is like totally drained from me. So, I mean, again, not great, livable, but like the pain is definitely like the worst part of my period. The other thing that I wanted to mention that can be common with endometriosis that I kind of mentioned earlier is about symptoms with bladder issues, bowel issues, just like general gastrointestinal kind of symptoms that come up when you have your period, which is common. And it's kind of that like, you know, it's like when you have your period and you're experiencing a lot of pain, then you take, you know, your doctor may have given you a prescription for anti-inflammatories like prescription level Advil, but then those can like irritate your stomach. So you're getting like some like weird GI pain. So it's kind of like that balance of not trying to irritate your stomach, but then like also trying to treat your pain. So that can kind of like upset your stomach as well. And for me, I have had a lot of issues with like bladder pain. So and I actually kind of have this, actually most of the month I experience this. So I would say almost every morning that I wake up, because your bladder like fills up as you sleep. In the morning I'll get up and I'll go pee. And after I pee, like your bladder, you know, obviously like is expanded out and then it shrinks down. And for some reason, that shift in my bladder will often leave me with like pelvic cramping. Like it feels kind of like a mini, not like a mini period, but like kind of mild to moderate level cramping. And I have that pain pretty much every morning. So almost every morning I'll like quickly go heat up a rice bag right after I go pee, or my husband will do that. And then that will like really take the edge off. But definitely when I have my period, like those bladder symptoms like are more intense, like the cramping. Oh man, like when I have my period and if I like hold my pee, which I stupidly do all the time, but if I like hold my pee and then I go pee, I don't know what it is. I don't know if it's like there's endometriosis, you know, lesions and adhesions that are around that area that kind of get affected by the change in your bladder, but that can be really painful, and also painful with like bowel issues as well. Moving like bowel, like after having like bowel movements and that sort of thing, that can also really increase cramping. I mean, also medication that you take can also make you constipated. So it's like just that whole area just gets like real angry when you have your period. So for me, that's kind of how I describe my endometriosis pain. I thought I would just kind of like jump into for a second, talking about whether or not, you know, endometriosis pain is as bad as labor pain. And having been someone who's like been through labor, if you're curious about like fertility, like my fertility sort of story, I have like a separate video sort of talking about that. If you're curious about whether or not endometriosis pain is kind of like having contractions, as I said, as I'm someone who has been through labor and experienced contractions, I will say it for the record here. They're quite comparable. I remember reading once in a book. The book I think is called Natural Approaches to Managing Endometriosis, I think. And I had read a little part of this book like far before I ever had a baby, and read this part about it saying like endometriosis pains can be compared to the same pains as a woman, you know, giving birth and having contractions. That endometriosis pain can be the same or actually even exceed that kind of pain. I remember like reading that and being like, is that true? Like, that's crazy. And now having been someone who's been through labor and experienced contractions, can absolutely say that yes, they are quite similar. And I wouldn't say that there's like different stages of labor. And I even took like prenatal classes and I kind of forget it all now. Just like put it out of mind. But like maybe not the very end stage of labor, like the very last stage of labor is like pretty wild. And I wouldn't say that the pain that I had at that point of labor, in labor, was as bad as my period pains with endometriosis. But what I will say is that kind of like the beginning stages of labor and even mid labor, like when you're in like the thick of it, is pretty comparable to having like one of your worst endometriosis periods that you've had. So, I mean, and what I will also say is that the one benefit that you have in labor is I sort of experience contractions like when you have a contraction, you have this huge, massive wave of pain that comes over your whole body, and it's just like terrible. It's like so painful. But then when the contraction is over, you kind of come out of it and you're like, hey, I'm here again. And you feel kind of normal for a few minutes, however long your contractions are apart. And so you kind of get this like relief. Whereas at least with my endometriosis, I like typically you just go hours like without relief. So that's another thing that like honestly is worse about endometriosis compared to labor. Wrapping up this video, it doesn't matter what stage of endometriosis you have. There's no research to back up that if you have stage 1 endometriosis, for example, that your pain is necessarily any less severe than somebody with stage 4 endometriosis. And kind of with that said, I sort of feel like, you know, pain is pain. And even if you don't have endometriosis, I mean, we know that pain from endometriosis is caused from like having endometriosis disease actually in your body. Whereas pelvic pain could be caused just by painful periods or something else or an unknown source. but they can kind of present in the same way. And so I feel like if you are experiencing symptoms that I've described, I mean, your pain is valid. You know, having this kind of pain is debilitating, can really affect you and the quality of your life and your mental health. And so I really encourage you to reach out to your doctor, advocate for yourself, find a doctor who's willing to listen, who is willing to ask you about your pain, who's willing to monitor your pain. You know, even if, you know, there's no cure for endometriosis, and even kind of finding a pain management plan is a bit of like a journey, a bit of like a trial and error thing. And even though there's no like magical solution for a doctor to like fix your pain, it doesn't mean that you're not worth being cared for, and having a medical provider like regularly check in on you and check in on your pain. Because having that is like, first of all, such a gift to have a doctor who you have a good relationship with, who is able to have, is able to make space to ask you these kinds of questions. And it really helps you feel cared for, in knowing that you've got somebody who's going to talk to you just specifically about your pain, and a pain management plan. So I hope this video was helpful for you. I'm so curious to know if you have endometriosis, what your pain is like, how you experience it, how it might be similar or different than some of the symptoms that I've described. So make sure that you like and subscribe to my channel, because I have lots more videos talking about my journey with endometriosis, that I hope is helpful for you. So I will see you in the next video. Bye!